Hello everyone, thanks so much for joining me today. My name is Lydia and this is Time with Lydia, the pharmacist. A warm welcome to you all. This is a channel where we educate ourselves on common health problems. We provide advice and information on health and well-being. So if you haven't yet subscribed, please do hit on that subscribe button and also on the notification bell so you don't miss any video that I upload. Today, I'm going to be spending some time with you talking about a very common skin condition. We are going to be talking about ringworm. Most people think that a ringworm infection is caused by a worm, but in actual fact, a ringworm is caused by a fungus. It's a highly contagious infection. It is called ringworm because of how the rash looks. It's shaped like a ring that is red and swollen on the edge and healthy looking in the center. Ringworm affects people of all ages, but it's especially common in kids. A ringworm can appear anywhere on the body. It can appear on the scalp, the beard area, on the hands, around the groin area, on the fingers, and on the feet. Medically, there are different names for ringworm based on where it is located on the body. The term ringworm is mostly commonly used to refer to ringworm on the body, which is medically known as Tinea Corporis. This form often appears as patches with the characteristic round ring shape on your torso or your limb. It can pass on through close contact with an infected person or animal, or from infected objects such as bed sheets, combs, or towels. Also from infected soil, although this is less common. So how would you recognize ringworm symptoms? Ringworm can be a little annoying or really uncomfortable. Symptoms may vary depending on where the infection occurs. On the skin, it usually starts out as a small red area. As it grows, it spreads out in a circle or ring, or even several rings. The edges of the rings are raised and red, and the rash may itch. It may sting or burn. The rashes can sometimes develop into blisters. On the scalp, it begins as a small bump or scaly patch that looks like dandruff. The bump or patch gets bigger and the hair in the infected area can break off. This can leave scaly patches of baldness, but the good news is the hair would grow back once the ringworm heals. This type is mostly common amongst children. Ringworm can also affect the beard area, and this can cause bald patches around the cheeks. This may look like acne or another kind of skin condition. Some people may experience fatigue or swollen lymph nodes. Now, ringworm on the hand. This would usually be caused by touching another affected area, such as your groin or your foot. Infection of the hand may look like very dry skin with deep cracks on the palm. If the infection spreads, you may see ring-shaped patches on the back of your hand. Now our focus for today, how can you cure ringworm at home? I'm going to take you through a few points that you can carry out to help cure ringworm at home. So number 1, apply a topical antifungal. Most cases of ringworm can be treated at home. Over-the-counter antifungals can kill the fungus and promote healing. Speak to your pharmacist first. They can look at the rash and recommend the best antifungal treatment for you. This might be a cream, a gel, or a spray, depending on where the rash is. You may need to use this antifungal treatment every day for up to 4 weeks. And it's important to use it for the right amount of time, even if the rash has gone away. The pharmacist will tell you if they think you should see a doctor. Effective medications that you can get from the pharmacy include miconazole, clotrimazole, or terbinafine. These are preparations that you can buy from the pharmacy without a prescription. Once you purchase any of these preparations, this is what you have to do. Clean the area and then apply a thin layer of antifungal medication to the affected area 2 to 3 times per day, or as directed on the package. Spread the treatment beyond the border of the rash by a couple of centimeters and allow the medication to absorb into your skin. Number 2, let it breathe. Do not cover the affected area with a plaster or bandage. Allow it to breathe. Bandaging the rash locks in moisture and slows the healing process. Instead, wear comfortable, loose-fitting, breathable clothes to speed healing and avoid spreading the rash to other people. Number 3, wash your bedding regularly. It is even recommended that you wash your bedding daily. And this is because ringworm is highly contagious. You should wash your sheets regularly to get rid of the infection faster. Fungal spores can transfer to your sheets. If you sleep on the same sheet night after night without washing it, it can take longer for the ringworm to heal, and the infection can spread to other parts of your body. Contaminated bedding can also infect your partner. Use hot water and a detergent when washing your bedding and any other infected clothes. Number 4, change wet underwear and socks. If ringworm develops on your feet or groin area, keep these areas dry. If you sweat a lot during the day, bath with a mild soap and then reapply your antifungal powder or lotion. Make sure the area is completely dry before putting on a new underwear or socks. Number 5, use an antifungal shampoo. When a ringworm develops on your scalp, the infection can be quite severe and symptoms can include itching, patches of hair loss, scalp boils, and severe dandruff. If you have ringworm on your scalp, wash your hair with an over-the-counter medicated antifungal shampoo. These shampoos kill bacteria and fungus on the scalp and prevent inflammation. You can purchase antifungal shampoos from your grocery store or from your local community pharmacy. Look for shampoos with antifungal active ingredients such as ketoconazole, selenium sulfide, and parathion zinc, and make sure you use the shampoo according to the directions on the package. Number 6, take a prescription antifungal medication. Continue treatment with an antifungal cream, powder, or shampoo until the rash completely disappears. The infection may return if you stop treatment too soon. You should contact your healthcare provider if your infection gets worse, that is, it starts spreading or doesn't go away after using non-prescription medication for about 4 weeks. When you or your child has ringworm on the scalp, ringworm on the scalp may need to be treated with prescription antifungal medication. Make an appointment with your doctor or your dermatologist so they can take a proper look once the ringworm starts getting worse. You may have to take a prescription medication for weeks to months, depending on the severity of the infection. So once you have a ringworm, you want to stop it from spreading so other people around you would also not develop it. And as we have mentioned, it's an infection that takes a long time to go away, and you want to avoid this happening to other people as much as you can. So to stop ringworm from spreading, start treatment as soon as possible. Wash your towels and your bed sheets regularly. Keep your skin clean and wash your hands after touching animals or soil. Regularly check your skin if you have been in contact with an infected person or animal. Take your pet to the vet if they might have ringworm. For example, when you realize that there's patches of missing fur. Do not share towels, combs, or bed sheets with someone who has ringworm. And do not scratch a ringworm rash. This could spread it to other parts of your body. And to prevent yourself from getting a ringworm, like I always say, prevention is better than cure. Take a shower or bath every day, especially after playing sports or sweating, and dry off completely. Wear clean clothing and change your clothes every day. Use clean towels and don't share towels or clothes. Wash your hands well with soap and water after playing with pets. So today our takeaway is don't ignore ringworm. Although it's a common skin infection, quick action is necessary to prevent spreading the fungus. You should always make sure you know how to prevent future infections. For example, don't share personal care items such as towels, clothes, and brushes with others. Wash your hands often and learn how to recognize ringworm in people and animals. I hope you have learned something new today. Please give this video a thumbs up, share with your family and friends so we can all update our knowledge on ringworm. And if you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss any of my videos. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.